What do you think? What should be the content in this session? After this, after hearing the auditing's perspective, should be auditor's perspective also, right? Okay. So why this is indispensable in laboratory quality management? You are going to speak, not me. This is not my session. To identify the root. Okay. Is it the only way available? Sorry? And improvement. Okay. Is it the only way available for improvement? Self-assessment, self-appraisal. Is it enough? Why do we need audits?
We usually overlook certain things which we can't help.
Impartiality, we overlook. What is the element? That element of bias will always be there. We cannot and we don't want to accept our own mistakes or loopholes, right? So we need audits to be done precisely by others, I mean external agencies. Okay. So let us see what it is. First of all, what is quality management system? I'm a professor. I'm going to ask you. You are also professors, but it's my habit to ask you and keep you awake. What is quality management system? Maybe a partial answer would be appreciated. What is quality management system? Sorry?
A setup to maintain the quality.
A setup to maintain the quality. Okay. Any other input?
Standard guidelines to follow.
Okay. Standard guidelines to be followed. Okay. Those are documented and we have to follow. We have to comply with it. So let us do post-mortem of the definition. A quality management system can be described as a set of 12 quality system essentials, QSEs, which are the organization, personnel, equipment, purchasing and inventory management, process control, information management, document and document control, occurrence management, assessment, occurrence management, risk assessment and legal assessment, process improvement, customer service and facilities and safety. These are 12 quality system essentials. And with this, these are the pillars on which the quality management system is based. In any company or for that matter, this is laboratory here. Okay. So what is needed? Why this quality management system is needed? To control, assure and manage. Control, assure and manage the quality. Do we control quality? Can we control quality? We control quality towards the lower range. We set our bars up and down. Okay, and we avoid or we prevent going it down. Okay, we do not allow degradation of the quality. That's why that is how we control it. Otherwise it is monitoring of the quality, not controlling. We don't restrict its bar going down, right? But we prevent its degradation. Assurance and management of the quality. Okay, so these 12 quality system essentials are going to manage the quality. Coming to assessment. For assessment, we need audits. We need assessments also. Those are interchangeably used. I use, but we will see the difference between the two. Audits of the laboratory are performed and we need to answer when, what, where, by whom. Okay, and we get the definition. So here the when is answered. Predefined time intervals. Some are planned, some are not planned, announced and not unannounced. Okay, so most of the audits are predefined. We usually do internal audits once a year, and NABL or other accreditation agency have their own set protocols of repeating the assessment. Okay? Assessing whether the laboratory complies with. So compliance of the laboratory with existing standards. Standards we all know. What are they? ISO 1589 and or some other accrediting agency like CAP. They have their own guidelines and standards. So the lab who is a client, or we can say the body which is accredited with that agency, has to follow the standards. Okay. For comply with the defined quality system processes, and this can involve procedural and result-based assessment criteria. They have their own assessment criteria. The checklist which we call it. The performing of audits by medical laboratories will ensure the pre-examination, examination, post-examination, we call it as pre-analytical, analytical, post-analytical, and other relevant associated procedures. It may be finance, it may be inventory. Okay, so these are the supporting processes are being conducted in a manner that meets the needs and requirements of the users. Here, users for us, laboratory are patients. Okay. So this is the definition given by ISO 2018. To be effective, the laboratory auditing should report both non-conformances and corrective actions. First, non-conformances. But along with that, we have to highlight the areas of good practice, strengths. Okay? And the non-conformances actually are the areas of improvement. We do not call NCs, we call areas of improvement. And these are the challenges, maybe opportunities also, which we can overcome and improve upon in the laboratory processes, so that other laboratories or the departments can exchange information. In bigger laboratories, larger laboratories, we may see that histopathologists coming to biochemistry section and doing the audit. Okay, because those are qualified internal auditors. Now, some certain areas are of good quality area. Some processes are well defined in biochemistry section, which that auditor can take back to his section and improve his own processes. So it is like learning process. Each time during the audit process, it is a bilateral process. We auditors also learn. Even I have learned from many labs. And we used to teach them whatever we know, the better part of a given quality standard procedure, or implementation, or a record, a way of creating a record. So this is how the information, good information is exchanged, and we spread the good clinical practices. So here are the good audit practices. And this part I would like to stress upon is this is a culture. Audit is a very serious business. It's a professional activity. It has to be serious and professional only. There should not be any element of human interactions or manipulations. It is going to be there because humans are coming to audit your laboratories, not robots. You know auditors personally, okay? And few good interactions also make few of the NCs be scrapped. Right? This happens, right? So this element is going to be there. This human interaction will modify the audit reports whenever the audits are coming. Will be done, right? But this is a culture. This is not a single activity. Why culture? एक बार annual का audit हो गया, खत्म हो गया, ऐसा नहीं होता ना, right? We have to plan next annual audit after 6 months of the first annual audit. We have to prepare. We have to inculcate that habit in our laboratory staff. They have to be aware and well trained to face the auditors. So it's a culture. it may not be a daily activity, but yes, it needs preparation. Most of the time, what happens, the technicians are very good at doing a particular quality process, or technical process. But when they face auditors, they succumb. Okay, and they cannot perform well. Though they are competent, they cannot perform well, and auditor have a perception that the person is not competent. And then the training पे कुछ NC आ गया था, okay, कुछ quality पे NC आ गया था. So this happens. So it's a responsibility of the leadership in the laboratory to train your laboratory person so that they can face audits comfortably and confidently. Okay? So this is what a culture of continuous improvement will be. There are certain definitions which are used interchangeably. So I thought I'll just mention and tell you the difference. Accreditation, process by which an authoritative agency, body or accrediting body gives formal recognition that this lab is competent to perform a particular test. Invariably, okay, and carried. Then what is assessment? Assessment is defined as systematic process of collecting and analyzing data, the audit data, to determine current, historical, and projected condition of an organization, process, or activity. This is very important. Current, historical, and projected condition, which separates it from audit. Audit is a systematic, that doesn't mean assessment is not systematic, it is systematic. Systematic, independent, documented process for obtaining audit evidence and evaluating that audit evidence against audit criteria, objectives, extent to which audit criteria are fulfilled. Now, if you compare assessment and audit, you can see the major difference. Here, the assessment will evaluate laboratory whether to give accreditation or not. Okay, current, historical, and projected condition based on your past IQC plus performance, the quality system procedures. Enable is going to give you accreditation for 2 years with one verification audit or re-verification audit, like in the form of on-site surveillance, or it may be a reassessment, okay, or desktop surveillance. With this verification, Enable is going to ensure your accreditation status. But they give you accreditation for the next 2 years. Based on what? Based on your current historical data. So this separates assessment from audit. And assessment should be used when it comes to accreditation, not the audit. That's why Enable says Enable assessment, not Enable audit. We can call internal audit because internal auditor is not going to give you the accreditation. It's not going to evaluate your futuristic, prospects. Enable sees your futuristic prospect, how effectively you're going to perform in future as well, depending on the present data. And then they will give you accreditation for the next 2 years. That is the difference. That is assessment. Even for passing student, we pass student in a particular year so that we expect this is going to pass the next year also. That is what the assessment. Audit evidence and audit criteria. What is audit evidence? The evidence which auditor finds during the audit. It may be a record, it may be a statement of fact or other information which are relevant to the audit criteria and it is verifiable. It should be verifiable against the available standards. जो स्टैंडर्ड में दिया है उसके बारे में अगर ऑडिटर बोलता है तो ठीक है. It should not be based on the reads and fancies of the auditor. नहीं मुझे ये लगता है इसलिए ये NC नहीं. Standard में दिया है इसलिए वो NC. And you are not following that side is NC. Okay, so that is record, statement of fact, or any other information. And audit criteria is a set of policies, procedures, or requirements used as a reference. What is the reference these auditors are using? Audit criteria. They use a checklist given by NABL. That is the audit criteria, and the standards which I use as a reference are ISO 1590-2010 version recently, which is the current one, and NABL 112. Along with there are other relevant guidelines as well. So that is the standard used and used as a reference, and the checklist is the audit criteria. Audit findings versus audit conclusions. Audit findings. Results of evaluation of the collected audit evidence. Audit evidence, maybe for me, I found that in a given month, ICA's outlier has not been evaluated. In the month of June, or ICA's outlier was not evaluated. That is my evidence. Okay. Now, what is my audit finding? Result of evaluation of the collected audit evidence again is the audit criteria. What does criteria says? There should be root cause analysis of the ICA's outlier. That is not done. So, root cause analysis of the ICA's outlier has not been done. That will be my audit finding, because I am corroborating that audit evidence with the audit criteria and coming to a conclusion that is audit finding. That's why most of the time you see during audits that evidence कुछ और था, NC कुछ और मिला. It is in the same area, same clause, but the statement is different. जून में क्लास नहीं हुआ था, लेकिन आपने root cause analysis पे NC ले लिया. Auditor will see the evidence and evaluate it against the standard, and then will find a broad root cause analysis. Broad. एक specific देके क्या करेंगे? What will you do? You'll do that evaluation for that particular month and submit. That story doesn't end there. You have to implement your USP of root cause analysis. So I would rather say in my statement, USP of root cause analysis of ICA's outlier is not implemented adequately. I will go to the evidence. So this is how NC statements are written, so that the problem or the NC will be in a broader sense, and it will be implemented adequately. The USP will be implemented adequately. I will also investigate into whether this has happened once by mistake or this is happening again and again. So if I find that the ICA's outlier evaluation has not been done for 2 months, 3 months, so it is delivering data. Means, or maybe the lab is reluctant to do that. Okay, then the NC statement will be little stricter. Okay. Conclusion. Audit conclusion, outcome of an audit after consideration of the audit objectives and all audit findings. What are audit objectives? For internal audit, you decide your objectives. आपको scope में देखना क्या है? NABL, when that agency plans for audit, they decide the objective. Maybe a first assessment, on-site surveillance, re-verification audit, because of change in location, change in equipment. So scope will be decided by the agency. Okay? And they will decide the audit objective. And all audit objectives and audit findings will be corroborated and we will come to a conclusion. That is audit conclusion. I'm just taking this definition because we may have to refer these definitions during our subsequent slides. What are the categories? You know this definition, so I'll just rush through the slides. Internal audit, first party audits and internal audits. What are they? What are internal audits? Who plans the internal audit? Sorry? The organization or laboratory plans the internal audit. The auditor can be an employee, as we just took an example of a larger lab, can be an employee or someone hired by the organization to perform the internal audit. We'll come to that later on, how to select the internal auditor, what will be the criteria. This type of audit is focused not only on whether the company processes meet the requirement of standard, but all rules the company has set for itself. See, for annual audit, annual uses the checklist, its own checklist. And we are trained to use that checklist only. But if you're calling internal auditor, because it's your laboratory, you can make your checklist more comprehensive. You cannot delete points. Huh? Minimum requirement, you can use the annual checklist, but you can, because it's your company and you want to add few more points in that, you can make your checklist more comprehensive, robust, right? बड़ा हो गया तो चलेगा लेकिन सब पॉइंट कवर होने चाहिए. So that will be the audit criteria for your internal. That is what I want to say here, that you can add more rules or a criteria in your internal audit criteria. Okay. The audit will look for problem areas, opportunities for improvement, and the effectiveness of the quality management system. By design, these audits can and should be much more in depth. As I have said, you can make your audit criteria more stringent. Okay? So you can dig into the problem areas to the extent you want. Okay? The laboratory should be audited regularly, at least once a year. It is you who has to decide the frequency of internal audit. NABL says once a year, but you are not comfortable with that frequency, you can do that 6 monthly, 3 monthly, whatever way you want. Okay, but not less than that. Laboratory audit, there are external audits also. So external audit may be second party audit. What is second party audit? Not hired. Insurance agency. Oh, yes, yes. So what is done in that, sir?
They have their own interest in that.
Okay. Suppose one insurance agency wants to tie up with you for their clients. Okay, for their investigation. Though you are enable accredited, they have their own set rules which may be more stringent than NABL to decide whether that particular lab has to be on our panel or not. Okay, so they will do their audit. That is second party audit. It is not related to accreditation or certification, but it is the interest of the insurance agency or any other supplier or vendor into your lab, which will make them conduct second party. Okay. And depending on the result, they will decide whether your lab will be on their panel or not. Okay. You also can audit your vendor or supplier. You audit your reference laboratory. So that is what? That is second party. Okay. The second party audits would not be necessary once a certification body, that is what I told. Even if your lab is anywhere accredited. But if they want, they can conduct. Then coming to third party audit. Third party audit, we know that is, those are annual audits. Okay. Or CAP. And the standard we just have discussed, ISO 1509 and enable 1. Three types of audits used in this process, like certification audit, maybe first assessment, second assessment, renewal of assessment, then maintenance or surveillance audits, and re-verification and recertification audits are the types of third-party audit which NABL conducts. What is vertical and what is horizontal? What is vertical audit? Example. Vertical audit involves the checking of all the processes, all the aspects of quality system within an area. All processes, maybe managerial, maybe technical, okay, all processes. And horizontal, I will restrict to a process, I do horizontally in histopath, in EMAT, in clinical path, in biochemistry, let's check that process. Maybe report release, maybe amendment of reports, maybe not verification, it's restrict to a process and I'll go investigating that part, or reading that part across the disciplines. Okay, so one process is audited across many departments. Will be the horizontal audit. When your organization conducts management system audits, do you have confidence in its conclusion? एक कोई भी audit हो रहा है आपके यहाँ पे, okay? Are you satisfied with the audit? Whether the audit has been conducted properly? Are you happy with the result? Or how do you know that audits are robust and repeatable? If the same processor comes next time, after 2 years, 3 years, or internal audit I am talking about. So, do you expect that the same quality audit will be conducted at that time also? So, what is the criteria to decide the quality of audit? This ISO 19011 version has defined the criteria. They have laid down guidelines for auditing management system, and those are the guidelines which we can use for deciding whether the audit conducted in our laboratory was of good quality or not. So it gives you principles of laboratory audit. What are the principles of reliable audit? First of all, integrity. What do I mean by integrity? What do you understand by integrity? Integrity of audit. Should not be biased. Okay. This I mentioned that there will be a constant interaction between auditor and auditee. Okay. And I just mentioned that it's a serious business, professional activity, let it be professional only. So a professional integrity has to be maintained during the whole audit process. Friendship उसके बाद जब audit report submit हो जाए. Okay. So that is what integrity is. Fair presentation. Fair presentation means fair presentation by auditor as well as auditing. Auditor has to justify the role for which he is appointed. Auditing has to show the transparency for which the auditing has been chosen by the lab director or laboratory leadership. Okay, so that is what the fair presentation is. Give maximum output, show your competence with confidence. Give professional care that you are going to comply, you are going to show that you comply with the standards. Confidentiality. It is not only auditor's responsibility to maintain the confidentiality. मैं इस लैब के बाहर जा रहा हूँ, मुझे कुछ बात नहीं करना, लेकिन लैब में गया तो. So both auditor as well as auditee are equally responsible to maintain the confidentiality of the complete audit process. Okay? So it's a part. It should be followed, otherwise it will not be a reliable audit. Independence. Independence, as she rightly said, impartiality. Auditor को आपने बुलाया, या फिर NABL ने अपॉइंट किया, let him be independent. या फिर if your laboratory has decided to appoint your lab personnel only, but he should not be from the same area which is being audited. So biochemistry, the consultant will not go and audit the biochemistry part only. Hematologist can come and audit. But at the same time, it should be ensured by the laboratory leadership that he will be given independent status for the audit role, auditor's role. Otherwise, lab director खुद ही बोल सकता है, छोड़ना क्या, कितना ऐसे निकल रहा उनका, खुद की लैब कैसे निकालेगा. सो उसका इंडिपेंडेंस तो गया है ना, जो वो लैब में कर रहा था वही कर रहा है, वो ऑडिट भी उसको अच्छे से करने नहीं दिया. So the person has to be independent, has to be made independent for the auditors. Evidence-based approach, not on the leaps and pencils. उसका विश लिस्ट काम नहीं करेगा, वहाँ पे चेकलिस्ट काम करेगा. नहीं तो मुझे लगता है ऑडिटर को लगता है तो उसने एनसी निकाल दिया, पता नहीं उसका क्या आगे मेरे साथ A to Z कुछ नहीं पता, लेकिन उसने निकाल दिया एनसी. ऐसा नहीं होता. Auditor's responsibility is to ask them, the auditors, the reason for raising the NC. If you are not satisfied, auditor will show you the standard. I mean, the life is in the standard. This is where it is given, you are not following it. But ऐसा नहीं होना चाहिए कि आपने स्टैंडर्ड पढ़ा ही नहीं और बार बार उसको पूछ रहे हो, तो वो स्टैंडर्ड नहीं पढ़ा करके एनसी निकाल देगा, है ना? तो यू शुड बी अवेयर ऑफ द स्टैंडर्ड. नाउ डोंट आस्क रीजंस फॉर ईच एंड एवरी आंसर, बिकॉज it is the auditor who is looking at the tip of the iceberg when he comes for a day or 1.5 days audit. You people know your NCs better than the auditor. Then it's not a surprise for you to get NCs because you know your NCs better. अपने क्या नहीं किया खुद को पता होता है, वो ऑडिटर तो एक तो पता नहीं जाता है, right? So it should be a mutual understanding. It should be cohesive. Exchange of information. Show transparency to the auditor, and auditors will also behave in the way the auditor has to be. If you are not showing transparency, auditor is going to lose his head and raise few more NCs on that. Okay, so risk-based approach. Auditor will not only audit the given scope, but he may give you area of improvement, not as an NC, but observation in the allied areas. Suppose I was given a task to audit your laboratory information system. But while doing that, I got to know that there is some point in report format is missing. That has been overlooked by the lab, but I found that. So I can show you that as an area of improvement. It's an opportunity for improvement. Okay. Beyond my scope, I'm giving you some suggestions. So, because it's a risk involved if the report format is not having all the attributes. It may be reference engines, it may be collection time, whatsoever it may be, but risk is involved. So it should be a risk-based approach. Before finalizing audit findings, the auditor has to do risk evaluation in his mind what this NC is, how this NC is going to affect the patient result and ultimately the healthcare. Then that audit process, we can say it was a reliable audit. Okay? So these were the principles of laboratory audit.